Let's talk testosterone. If you're like most people, you think of testosterone as a male hormone, which it is. However, did you know that women need testosterone? Crucially, it's a crucial hormone for women. Now, we need only about 1/10 what a man makes, but it is important for inflammation. It's anti-inflammatory. It's good for our muscles. It helps our muscles respond to exercise better. It's good for our bones, bone health, intimately connected with testosterone levels. And then our brain. Our brain has testosterone receptors, and it is important for decision making. Forgive me for being stereotypical, but you know the stereotypical male that never asks for directions because he knows what he's doing? That's testosterone in a meme form. If we don't have testosterone, it can be difficult to make decisions. Also, here's a fact for you. Before menopause, a woman makes 3 times more testosterone than estrogen, than estradiol, and yet it's hardly ever talked about for women. In fact, did you know that there is no prescription strength testosterone dose available from traditional pharmacies for women? So women who have low testosterone are forced to use a man's medication and try to cut the dose by 10-fold. That's ridiculous. So we use compounded testosterone in our practice, either in the form of a cream. We can give injections, but we prefer either a cream or a pellet, which is a little tiny implant into the fat pad of your hip, and it lasts for up to 6 months. So that's a great testosterone form for women. But back to the issue that traditional medicine has no idea, unfortunately, what to do with women and testosterone. There was a time, I don't know, maybe 15 years ago, I was evaluating a woman's testosterone level, and it caught my eye that one of the major labs had a level of testosterone for free testosterone. Normal range was 0 to like 2. I was like, 0? How can 0 be an appropriate normal range? Really? If the normal range goes down to 0, then that means it's absolutely impossible for a woman to have low testosterone because you can't have less than 0. Well, that's ridiculous. Testosterone is very important for women. I called the lab director and I spoke with him. I pointed this out to him, and within about a month, LabCorp had adjusted their range to go down to 0.1. So yes, it's not 0, but it's almost 0. Now, why is that? It's because the vast majority of the time, the way they determine normal range is by taking their reference population and plotting out the values that they have for this particular lab result on what's called a scattergram, which forms a normal curve. This gets sciencey and it's statistics, but the law of statistics says that the population will distribute itself around a normal curve, with most people at average, and the further away from average you get on either end, less and less people have that value. So they plot this on a computerized program, and then they determine what is the value that 90% of the population has, because there's this big fat assumption that 90% of the population is normal, and therefore if you're at the 5th percent low level, then you're called low. Or if you're at the 5th percent high level, you're called high. And when you take 100 and subtract 10, you get the 90th percent. And that's how normal range is determined. Well, one of the problems with that, most doctors don't check testosterone levels on women who are thriving. So we know for women that the testosterone level peaks in our 20s and 30s. How much data do we really have on healthy, vibrant 20 to 30-year-old women to say this is the ideal for testosterone? We don't. So that normal range is probably including a lot of people who have symptoms of low testosterone. And now we're taking those symptomatic low testosterone people and saying that you're normal. So that's a huge issue because doctors don't know how to help women in their traditional training with low testosterone and these low testosterone symptoms. Guess what we're told? Well, that's normal for your age. You're 40, you're 50, you're whatever, you're stressed out. Here's an antidepressant. Because guess what? If you have low testosterone, you're sad. You don't feel good. You lose your motivation. Testosterone sometimes has affectionately been called the get shit done hormone. So if you have low testosterone, you don't feel like doing anything. It may not truly be depression, but it's a lack of motivation to get things done. So number one, you need to work with a doctor who understands the difference between normal and optimum. And just because something's in the 90th percentile, the middle 90% of the population, doesn't mean that's a healthy level. Then you need to work with a doctor who understands how to check testosterone levels. We need to know total testosterone and free testosterone. And then lastly, hormones are just messengers. We want to do more than just optimize your testosterone level. We want to optimize your body's ability to respond to optimal testosterone levels, which means you have to have working hormone receptors. This is where we're different from a lot of functional medicine doctors in our practice, because we understand that hormones need receptors like a key in a lock. And if you have beautifully forged keys but rusty locks, guess what? The door doesn't open. So we need to work on cellular health, decreasing inflammation, repairing from toxic exposures. Those are the things that we take a deep dive in with our patients at Vitality Renewal, and you need to work with someone who understands that. Hopefully you have someone. If not, you're welcome to reach out to us and we'd be happy to help you. And then what can we do to move this forward? There's this huge testosterone gap in the literature, in the traditional medicine world. They just don't understand, and it's not gotten a lot of research. One of the things I want to do in my practice, and I'm so excited about this, is I really want to push this into the mainstream. I'm very fortunate that I have an academic nurse practitioner working in my practice part-time. The rest of the time, she's actually a professor at one of the universities here in Illinois. We are working together to try to come up with a study looking at symptoms of testosterone excess or deficiency in women and how they respond to testosterone therapy and what their levels are, because we really think that these levels that are discussed as normal in the traditional literature are actually low testosterone. So we want to identify what an optimal testosterone level is and get that out there so that people know and understand. And let's bring this out in the open. Women, we need testosterone. Without it, you're going to be always feeling a little bit behind. And we still got it. And we have a lot of stuff to do in this world. And we have a major contribution to make. Let's make sure all of our hormones are optimized in order to help us get that stuff done.